How to understand correlation versus causation in DTC genetic results. Imagine you get your genetic test results and see that people with a certain gene variant tend to have a higher risk of a health condition. Does that mean the gene causes the condition? Not necessarily. It's easy to get confused between two ideas that sound similar but are very different. Correlation means two things happen together more often than by chance. For example, maybe people with a specific gene variant also tend to have a certain trait, like a preference for a type of food. But just because they happen together doesn't mean one causes the other. It could be a coincidence, or there might be another factor involved. Causation is when one thing directly causes another. For example, if a mutation in a gene causes a disease like cystic fibrosis, then that mutation is the cause. It's a direct link. When you see a genetic change that is known to cause a condition, that's a causal relationship. Most results from direct-to-consumer genetic tests show associations or correlations. That's because many traits and diseases involve many genes and environmental factors. It's hard to say one gene alone causes a trait. For example, height is influenced by hundreds of genes and lifestyle factors. A test might show a correlation with certain genetic markers, but that doesn't mean those markers cause height differences. It's also important to understand that population studies often find correlations. These studies look at large groups of people and find patterns. But these patterns might not apply to every individual. A person's environment, lifestyle, and other genes all play a role. So, don't assume that a genetic association means you will definitely develop a condition. If you see a genetic result that points to a single gene disorder, like a mutation known to cause a disease, that's a clear causal link. But for complex traits, like risk for heart disease or diabetes, the results are usually correlations. They suggest a higher or lower risk, but they don't guarantee an outcome. Scientists use special methods to figure out if a relationship is causal. Techniques like Mendelian randomization look at how genes influence traits across populations. But these methods are complex and not part of what you see in consumer reports. Always remember that lifestyle, environment, and personal choices also influence health. A genetic correlation doesn't mean you will definitely have a certain trait or disease. Use your results as a guide, not a diagnosis. Talk to healthcare professionals or genetic counselors to interpret your results correctly. Understanding the difference between correlation and causation helps you make smarter decisions about your health. It keeps you from overestimating risks based on genetic data alone. Instead, it helps you see your genetic information as part of a bigger picture that includes your lifestyle and environment.